All right, Olivier, over to you.
Hi, everyone. Thank you, everyone, for coming for this session. And I'm going to talk to you about some preliminary finding from an investigation that I am conducting with a talented group of researchers from the Community-Based Research Center and the BC Centre for Disease Control to try to kind of better understand what are the drivers of syphilis infection among gay, bi, and other MSM. I probably don't need to give you that much context for why this work is happening. Syphilis has been on the rise among gay and bisexual men in BC and other places across the country for a little while. And while this epidemic has been going on, it's still unclear what is driving the epidemic and what is the best way to respond to it. The main focus of research and our response have been on behaviors in trying to increase, response have been trying to increase health literacy and encourage people to get tested. And the success of this approach alone have been debated, and obviously we are not seeing a decline, so it's not quite working. An alternative way to intervene and study syphilis infection would be to look at it through a syndemic framework. And I think a lot of you are probably familiar with syndemic theory, but if you're not, it emerged from the work of Meryl Singer in the US. This framework helped to kind of reveal the complexity of how health inequities are produced and sustained, and how different health inequities are kind of co-occurring and overlapping to create cluster of epidemics. The first application of syndemic theory to gay men's health was done through the work of Ron Stahl in the US, and what they found in this groundbreaking piece is that most of the cited risk factors for HIV infection among gay men that researcher had the tendency to study in silo were actually all related to one another. So we cannot really understand them in isolation. We need to look at them together. And since the publication of Ron Stahl paper, there's been actually a lot of publication on syndemic related to HIV risk, including Canadian study, including data from the SexNow data and some work done in Ontario, and now this syndemic theory is being taken up to look at HIV across the globe, particularly with gay, bi, and MSM. So just to be clear what we are talking about when we look at syndemic describe how health problems among a marginalized population tend to co-occur, overlap, and fuel each other to create clusters of epidemic. So often people are aware of that definition, but what people are kind of forgetting, and that these clusters are not just happening like this. They are the product of social inequities related to class, gender, and sexuality, and unfavorable structural factors. So we need to think about it through a social determinants lens or social justice lens. While syndemic theory has been used a lot to study HIV risk, now we are seeing this framework to be used as well to look at other health issues, such as smoking or looking at suicide, but it hasn't been used, as far as we know, to look at syphilis infection. So the purpose of our research was to try to see if a syndemic framework can help explain how the syphilis epidemic affecting gay, bi, and MSM is produced and sustained, and if it does, can it help stimulate new prevention effort to reverse this inequity? We use data from the SexNow survey, and I think a lot of you are probably aware of that. SexNow is a project of the Community-Based Research Center for Gay Men's Health. It's been going on in British Columbia since 2002, and in 2010 was expanded to the rest of the country. It's now completed online, and it's a completely anonymous survey. And for the context of this study, we used data from the latest survey, which was collected between November 2014 and April 2015. And the two main advantages of this survey, which allow this kind of investigation, is that one, it has a very large sample. SexNow is the largest survey of gay and bisexual men in the country. We had almost 8,000 respondents in the last survey. And also, it's very broad in what it covers. So it covers a lot of different domain, from sexual behaviors to substance use, mental health, community involvement, and experience of stigma. This is the way we conceptualize syndemic within the research project. We are, which is kind of consistent with some of the work of Ronsdahl, but also previous research that we've done on syndemic and HIV risk. But we believe that the conceptual framework, we believe that gay men are experiencing anti-gay stigma, and this can lead to the development of psychosocial issues such as mental health, anxiety, depression, and also substance use, which may have an impact on sexual behaviors, which may also have an impact on syphilis infection. And one of the new things that we added to this conceptual framework is the importance of healthcare interaction. So when gay and bisexual men are experiencing psychosocial issues, they may or may not have experience within the healthcare system, and those may be negative or positive. And if they're negative, they may have a negative impact on risk behaviors and syphilis infection. So in Sex Now, we do not deal with samples of we don't collect samples because it's an online survey. So we don't know the true cases of syphilis, but we ask gay and bisexual men in the survey, have they been diagnosed with a syphilis infection in their lifetime and in the last 12 months. I'm happy to say that in BC, we are way above well, not way above, but we are above the national average. We're doing pretty good in terms of syphilis. So about 1 in 10 gay and bisexual men in BC have had a diagnosis of syphilis in their lifetime, and about 3.9% have had a syphilis infection in the last year. That would not surprise anyone in this room. Or if you're familiar with the epidemiology of syphilis, there's a huge inequity between HIV negative and HIV positive men when it comes to syphilis infection, and we are seeing dramatic differences. So in red you have, in blue you have last 12 months, and in red ever, and what we're seeing is that HIV positive men, 5.8% of them had a syphilis infection in the last year compared to 2%. And that 14% of HIV positive men had a syphilis infection within the last year, and 34% reported having a syphilis infection in their lifetime, which is much higher than what we're seeing among HIV negative men. One of information that Sex Now give us that we don't have from traditional epidemiology, which doesn't collect differences between sexual identity. They just collect information on behavior, so we know if people are MSM or if they're not MSM, but we don't know if they identify as gay or bisexual men. And what we're saying in Sex Now is that there are kind of dramatic differences between someone that identifies as gay or bisexual man or other sexuality, and find that gay men were more likely to report a recent syphilis infection or history of syphilis infection diagnoses in their lifetime in comparison to bisexual men. And also we have seeing dramatic differences across partnership status, and seeing that gay and bisexual men that are single or partner with a man are more likely to report recent and a history of syphilis infection than the MSM who are partner with women, which often, there's the myth where in public health that those are the people most at risk of infection, but we are not seeing that in our data. So this is some demographic that I think was important to put forward for the discussion. And now I'm going to look at some of the syndemic factor that we're looking at, starting by anti-gay stigma. And we are, for the context of this research, looking at recent syphilis infection, so infection in the last year. And we look at different indicators of anti-gay stigma and find that among gay and bisexual men who experience these forms of stigma, syphilis infection appear to be higher. For example, if we look at verbal violence, 2.9% of the people that did not experience verbal violence, among those that did not experience verbal violence, 2.9% had a syphilis infection in the last year, but we have 3.8% rate among the people that did experience verbal violence. Although this one is not statistically significant, all the other one were. And we kind of see one that shocked me when I saw the data and kind of was a surprise to your team, and seeing how having lost career opportunities because of your sexuality was associated quite dramatically with a recent syphilis infection, where those that had lost career opportunities, 8.3% of them had a syphilis infection. Those anti-gay factors, don't exist in a vacuum, and we know that if someone is experiencing one form of stigma, they're more likely to experience another form of stigma. So we're looking as well as the cumulative count of marginalization. So among the people that reported none of the marginalization factor that we look at, 2.6% had a recent syphilis infection, and as you can see, it goes up dramatically to 10% for those that reported 3 or 4 anti-gay stigma indicator. So our new variable in our syndemic was to try to look at healthcare discrimination. And we asked gay and bisexual men, have you experienced healthcare discrimination in your lifetime or in the last year because of your sexual behaviors or sexuality? And we find that in both cases, past history, but also experience within the last year, increased syphilis infection. So 5.2% of those that there was 5.2% of men who ever experienced healthcare discrimination had a syphilis infection, and almost 10% for those that experienced it in the last year, with an odd ratio of 3.8. So quite a significant. And we don't know what comes first, so one of the hypotheses could also be that people were discriminated because they had a syphilis infection. But either way, as a way to they felt they've been discriminated because they had a syphilis infection, the way the diagnosis was delivered, or they got a big lesson about safe sex. So maybe this is what's happening. But either way, we are seeing that a trend that that's a bit problematic. And then we are looking at different factors within that are kind of like the psychosocial issues that we're looking at. And again, we find several that seem to be associated with recent syphilis infection. So people were more likely to report a recent syphilis infection if they using kind of party drugs such as cocaine, GHB, ecstasy, MDMA, and ketamine or crack. They were more likely to report a syphilis infection if they experience suicidality, having suicide thought or suicide attempt. Also, if they've experienced intimate partner violence, so if they've experienced violence from either a hookup or a partner. Frequent binge drinking, the rate is higher, but it's not statistically significant. And we asked if people have been in care for depression and anxiety, and find that those were also at higher odds to report a recent syphilis infection. As I previously mentioned, Syndemic is interested in the effect of multiple drivers. So we are seeing the same trend that we were seeing with anti-gay marginalization. So if men reported none of the indicators that were in the previous slides, we are seeing that recent syphilis infection was only 1.8%, and we're seeing a gradient which every additional health issues that someone report, there's an increased chance of them reporting a syphilis infection. And if people reported 4 of those indicators, for example, in the previous slide, 15.7% of them had reported a diagnosis of syphilis within the last year, and 25% if they reported all the 5 indicators that were on the previous slide. Therefore, supporting the idea that syndemic are occurring in driving syphilis infection among gay and bisexual men. So we are still kind of making sense of this data as a team, and we had a lot of discussion and kind of felt, wow, there's a lot of things here that we never consider or that are not really in the discourse around syphilis prevention. So, it seems that, we are still trying to make sense of what are the implications of these findings. So if we find that some of the factor that seems to be the most associated with syphilis infection are healthcare discrimination, partnership violence. What does that mean for some of the effort that we are doing right now, which are probably solely focused on, or primarily focused on, identifying syphilis and getting people to get tested, or doing campaign and posters. So are those helping us to contain the syphilis epidemic? I'm not sure, so maybe we need to broaden our approach. And what does that mean for clinical care? I know some of you are in this room, or clinicians, nurses, or doctors. So what does that mean when you have someone with syphilis? Should you then try to screen for other psychosocial issues, including partner violence, and the other way around? So if you have someone with that experience, like violence from their partner, should you screen them for syphilis? And also, that means, also we need to think about, Syndemic is really calling for a more holistic approach to kind of any health issues, so including syphilis. So if we only focus on the syphilis part, but we don't do any prevention or attention, or we don't drive attention to the other factors that are driving this epidemic, how are we going to really contain or reduce syphilis infection among gay and bisexual men if we continue to just look at sexual health and silo of other issues going on in the gay community? And I think perhaps if we think about trying to build more holistic intervention that address multiple health issues, maybe there are opportunities to kind of develop cost-effective intervention that are guided by a syndemic orientation, because we might be able to pull different resources together to address an array of health issues instead of having our focus on a single one. So I thank you. This is my contact information. So if you want to talk to me about syphilis or syndemic, feel free to get in touch with me. The team is kind of working right now to try to write this up for as a report. So we'll have this available maybe soon, in the next year, I guess. So thank you for your time, and thank you for being here.